feel like dietitians are practicing in so many different areas. I'm like, oh my gosh, you do that? Oh my gosh. So I feel like for interns, they need to like know that when you graduate, maybe your first job might not be like your dream job, or you're just taking a job just to kind of, pay bills and stuff for the time being. But just knowing that down the road, there are so many different areas you can explore. It's just amazing.
Do you ever have so many questions and no one to ask, so they're just wasting away on Google searches you'll forget about in an hour or so?
We had that same problem, and that's why we created the RD2BE Podcast, a resource for dietetic and nutrition students looking for answers that their peers don't have.
We are students Macy and Emily and registered dietitian Carl Barnes. We engage in conversations and learn from RDs.
Join us weekly as we gain insight into the unique journeys of registered dietitians all over the country.
Welcome back to another week of the RD2BE Podcast. I'm your registered dietitian host, Carl Barnes. This week we are digging in, as always, with a registered dietitian to give their feedback and their kind of look back as a registered dietitian, giving their advice to undergrad nutrition students, interns, as well as graduate students who are on their path to becoming registered dietitians. We're joined by Noor today. She is a pediatric outpatient dietitian, but we're actually going to touch on not just that perspective, but also talk a little bit about Ramadan today. So I'll let you introduce yourself. Thanks so much for being here today.
Yeah, thank you so much for having me. My name is Noor, and I've been a dietitian for 13 years. I've practiced inpatient adults, inpatient pediatrics, and now for the past few years, I've been an outpatient pediatric dietitian, where I cover really a lot of different areas like failure to thrive. I do nutrition support, tube feeders. I do weight management on the side where there's low weight, failure to thrive, and poor weight gain. Do some food allergies, GI issues, just really kind of anything that comes through the door. And I've been doing that for a few years now.
Awesome. Well, I'm Emily, as always, your RD2BE from University of Maryland, College Park. So I'll get into the questions, but thank you, Noor, for being here today and talking to us. So how do you think that Tennessee State University, where you did your undergrad, prepared you for internships, but more specifically your internship at Vanderbilt?
Yeah, so when I was at TSU, which is Tennessee State University, I was very involved with my advisor. I worked with her as a research assistant, and by doing that, we did a lot of community work. We did work with Habitat for Humanity, where we did the nutrition classes. We did work in the classrooms and school settings, where we did nutrition educations and lesson plans. So I felt like just having that on my resume really helped me, because the internship that I did, which was at Vanderbilt University Medical Center, is divided into two parts. One semester is all clinical, and the second semester is all community. So it really helped me through that, because I did have a lot of that community experience that I used in the internship.
Did you have any clinical experience when you were an undergrad, or strictly in the community?
Yeah, so I did shadow people here and there, but I didn't like work. I did also work in a nursing home, but that was more like food service, but I didn't really have extensive clinical experience.
Great, thank you for sharing that. So during your internship, well, actually going back, so I noticed that when you were talking about doing your community work at your undergraduate school, that you worked in schools and stuff. So yeah. Is that how you got exposed to pediatric work, or did you get involved with it during your internship?
Yeah, so actually, when I was in the internship, I only got 2 weeks of pediatrics, and I was like, kind of intimidated by the whole thing, because it's just such a wide range from like preemies all the way to 18 years old. And sometimes I have patients now that are 18 and above that have been with me before, and there are tube feeders that wanted to stay with me. So they've stayed with me. So it's just such a wide range, and it could be kind of like anything that comes through the door. So when I did my internship, the first clinical rotation I had was pediatrics, and I didn't do anything after that. So, and I was like, oh, pediatrics is not for me. I'm not doing this. I just didn't have enough experience. So just briefly, after the internship, I stayed on at Vanderbilt and did adults and had to take time off after my first kid and then second kid. And then when I was ready to come back, they had a pediatric position open that my manager said, it's part-time, do you want to take it? And I'm like, I don't really have any experience, I'm not sure. She said, you'll be fine. So I just kind of changed focus and started pediatrics. I did start inpatient, and I think that was a little bit an easier transition than if I were to do outpatient. So I did get training, and something I never thought I would do at pediatrics, but I love it.
Are you working to get your pediatric credential, or how do you feel about that?
Yeah, so actually my manager has been on me about this to get it because, so I have my master's. She's like, what's the next thing for you? And I really have been thinking about it. It's just with COVID, and I have two kids and them being home, the past year has just been kind of crazy. So I just put everything on the side. But then, I just never can like do the same thing over and over. I started just kind of looking online to see what else is out there. So I don't know if you've heard of the Institute for Functional Medicine. Yeah, so I actually got into their certification program 2 months ago, and I started that. So I kind of convinced my manager to like let me do that for now, because in terms of pediatrics, I'm really doing, not that I wouldn't gain anything from the certificate, but I'm doing what I would still if I were to get the certificate. So it's nice to have the credentials, but I feel like I need something that's more than that, if that makes sense. But most of the dietitians that I work with do go that route if they don't do anything else.
Yeah. So why, besides for being offered a job for being a part-time, pediatric dietitian, what else made you want to stay at Vanderbilt after your internship instead of, going on to somewhere else?
Yeah, I was exposed to so many different areas because it is a teaching hospital, from trauma to different ICUs to burn, like I said, pediatric, med surg floors, inpatient, outpatient. I just feel like it's an area where I can really grow at. I can start somewhere. Like so after the internship, I started as a relief dietitian. And that was basically covering anyone that was off, covering any holidays that were not covered, just kind of anything really, or if there was a sick day. So I felt like that really helped me. It was always like a second internship because it helped me to do things on my own while also having mentors there. So I know that in terms of like being in Tennessee, I was going to stay in Tennessee. My family is here, so I was not going to move. In terms of like the largest hospital where I live, that's it. That's VUMC. So I just thought, you know what, it's a great place. I had a really good experience in the internship. So nothing like attracted me to go outside of Vanderbilt.
That's great to hear that like you had a successful internship. So you're like, hey, I want to stay here.
Yeah.
And that's really good that you were offered, a position after having children and things like that. So kind of switching gears, as someone who grew up in Iraq and someone who follows Ramadan, how do you keep up with it while working, like fasting all day?
Yeah. So when I first started working after the internship, I was working full time and also doing my master's. I really kind of struggled with it because I just had so much on my plate. But throughout the years, I felt more comfortable sharing with others what Ramadan is, what it means to me, how my schedule changes, how my eating habits change. And especially over the past few years, I've worked with my manager where I've saved a lot of my days off to where I can take them during the month. This way, I don't have to struggle with having energy to do education, especially in the outpatient setting where I'm doing educations and talking all day. And I'm just like, and I cannot drink during Ramadan. So it's hard for me. So just educating others, educating my coworkers, my manager. At the end of the month, we have a holiday. I usually will take sweets and just goodies to work to share with everyone. So I feel like it's my job to teach others, and it's not their job to go out and find out, hey, why is she doing this? Maybe they will, but I think part of that is my responsibility to teach others.
So for those who aren't that well versed in Ramadan, would you just mind explaining what the fast looks like, what you can and can't have, when you can eat or drink, and what that looks like?
Yeah, so Ramadan is the 9th month of the Islamic lunar calendar. And it shifts by about 10 days each year because of the moon phases and the lunar calendar. So during the month of Ramadan, we will fast from dawn to sunset. All right, so fasting is fasting from food, any drinks, water included. If you're a smoker, you can't smoke. You cannot take medications during the fasting hours. In terms of nutrition, if you're on nutrition support, like for example, tube feeding, TPN, you can't have that during those hours. But there are a lot of exemptions, all right? So if you are pregnant, lactating, if you're a child, if elderly, if you have any acute or chronic conditions, if you're on TPN, you're most likely not feeling well. But if you're stable on TPN and you do want to go ahead and fast, then you can adjust the TPN to get during the nighttime and not the daytime. So there's a lot of wiggle room for those that do want to fast, but also for those that really can't fast. And usually for those that cannot fast, they will donate money for each day missed or meals. So in terms of what meals look like, so our meals change because we're not, so let's say, depending on where you live in the world, sunset is going to be different, right? So for me, it could be that I'm fasting 18 hours. Another region in the world, it could be they're fasting only 12 hours. So during your lifetime, you will fast different seasons, again, because it shifts by 10 days each year. So for me, in the morning, like this morning, I woke up at 4:15, had breakfast at 4:30, which is super early for me to eat in the morning. And that meal is called sahur, and it's usually, again, it's before sunrise in the morning. So, and could be a breakfast meal or it could be a dinner meal. Sometimes it's too early for people to eat and they want to do a smoothie. They could do that as well. But I recommend doing like a meal that's well balanced, because you are going to have long fasting hours. Making sure you get well hydrated, again, long fasting hours, especially if you live in a region where it's becoming hot outside and you're spending time outside. A lot of people ask about caffeine during this time. You can still have it in the morning while you're not fasting, but it shouldn't be your main hydration, because again, it can cause dehydration. So that's going to be your first meal in the morning, and then you start your fast. And again, so for example, like I said, I woke up and had my breakfast at 4:30, and then today probably like 7:31 p.m. is when I can break my fast, which is really late for me to eat. I eat dinner earlier than that, but because you're fasting long hours, you're ready to eat anything by that time. So when we break our fast, it's usually done, and this is like a religious aspect to this, but also health aspect to it too. We usually break it with a date. And dates are easily digestible. They're a great source of energy. And I don't know if you ever fast, but if you fast and you're breaking it, try it with a date. It just gives you immediate energy. So we do that first, and then our meal. It's usually going to be a dinner meal. Doesn't have to be like today. I'm like, I think we want to have breakfast for dinner. So you could do that. It's up to you. But it is eating late hours at night. So it's important to get hydrated during this time. But that's the 2 meals that you have. People can have snacks after that, but usually there's not enough time between the time you eat and go to sleep to have a meal and hydrate and have a snack. It's just a lot.
So I guess that for Ramadan, breakfast is the most important meal of the day.
Absolutely. They
Yeah.
actually, people try to miss that because they want to lose weight. And I'm like, when Ramadan is over, you're going back to your like normal habits and eating patterns. You're going to regain that weight. And I really push for more balanced meals, especially in the morning, something with fiber in it to help sustain your energy levels longer. But many people will either not wake up because it's too early or because they want to lose weight.
So since you woke up, like you said, at 4:15 today, does your family follow Ramadan as well? Like your partner and your children, do they wake up at the same time too, and you guys all have a family meal, or do you just follow it? What does it look like in your family structure?
Yeah, so my husband is also fasting. My daughter, she's 8.5. She does half-day fast, not because she's required to, but because she just wants to be part of it. So where I'll have her have breakfast during her normal time, like 8:30 a.m., and then she'll fast until like the afternoon, just for a few hours. She's done some longer days, but she's not required to. That's not required. And during Ramadan, usually the breaking of the fast is the iftar, the meal in the evening is usually shared with family, friends, even as a community. But because of COVID, the past 2 Ramadans, we really haven't been able to do that. But usually it's like a shared time.
So I guess before COVID, do you live in an environment or with other people that follow Ramadan? And
Yeah.
like, how does that, I guess, celebration of meal look for you guys?
Yeah, so actually funny, I live on the same street as my parents. So I have we're 7 siblings, and one of my brothers and 2 of my sisters. So we're all on the same street. So even though this year we cannot, and last year we cannot, we've tried to like limit going to each other's houses because of my parents and all of that. We still like, you don't have to go and eat together. We share meals. I could be like, I'll say, hey, I've cooked this thing today. Don't cook as much. I'm going to share with everyone. But outside of COVID, usually, especially on the weekends, we go to the mosque, which is like our place of worship, and do potluck dinners there. Or it's become such a popular thing to invite people that you have to almost like book your day. I'll say like Saturday is mine, you're not taking that. So you kind of ahead of time will let the people know that you want to invite to your house, that this is the day I'm thinking about, please, make sure that you don't have anything else for this day. So it's really a time of gatherings. Because of this, sometimes meals and nutrition content of food might not be the healthiest because people are going all out to make like a delicious meal, and people fry more food during this time. But there are so many ways to make meals healthier, and I don't want to like go on and on about Ramadan. So I do have some guides on my nutrition page on Instagram. It's Nutrition by Noor. There's a healthcare guide for Ramadan. Also, there's guides for those that are fasting, and some of that will include like cooking tips. So if you're fasting and you're trying to figure out how do I make my meals a little bit healthier, please check that out. You can air fry, for example, instead of like regular deep frying. But this is not religious. This is more cultural. So the religion is not teaching these habits. It's more cultural, and just like like other holidays, you're more likely to go out in terms of what you're doing for your meals. But because this is a month-long thing, it's some people will actually gain weight during Ramadan because they're eating late and they're going all out with their meals.
So I know you said you didn't want to touch on it that much anymore, but I actually have a few more questions if that's okay with you about Ramadan. So this might be, a little far-fetched, but would you almost say that during Ramadan, during those morning and evening meals, people almost binge eat? or?
I would say it might start off like that, but at least for me and people that I know, it's just actually for me, I cannot eat that much because I get full fast. It's almost like my stomach shrinks and cannot take as much. So, but that's not the case for everyone. If you start off your Ramadan meals like and some people will say, you know what, I had my first dinner and then a few hours later I had my second dinner. So it really depends on the person, but I really haven't heard people sit down and eat more than one plate. It's just because your body is just adjusting to long hours of fasting. So, but it is what you do after the meal. Do you have a healthy snack? Do you eat again and then sleep on that, and then wake up in the morning, have breakfast, and then sleep again? It's just, and then people will sometimes think, well, since it's Ramadan, I don't have to exercise, so they don't do any exercise. So again, it's not religious aspect of it. It's more just sometimes even cultural. Like back home in Iraq, the shifts in working schedules too, like what time people work, what time they come home, where I think sometimes people get lazy because they're fasting, and it's true that you have less energy, but it's just what your body gets used to. So for example, for me, outside of Ramadan, I can run, I can do more intense physical activity, but with Ramadan, I do more moderate because I know I can listen to my body, and I know I really can't handle more than that because I have kids at home, I have long working days, and I usually try to get that in right before iftar, because then, which is a dinner meal, because then right after that I can replenish and have my food and refuel.
Awesome. So as a dietitian, at least many people that I've talked to, I don't really know about your philosophy, but eating more meals eating during the day is good for you. You shouldn't, just have breakfast or have dinner. You should have snacks throughout the day. So how do you go about that when you're educating people about Ramadan, who I guess you're working with, that probably should be eating more meals during the day, but because of this cultural, I don't want to use the wrong, holiday. Is it a holiday, or how do?
It's I think it's more a practice. It's actually one of the pillars of our religion. All right, so we have pillars. This is one of the pillars. So there are Muslims who are Muslims and decide not to fast, which is, that's up to them. So, but in terms of like how meals are supposed to be, the religion doesn't say anything about the components of a meal, but it does, recommend healthy eating and not overeating. And when we do this, and when I talk to people, the my plate method applies during Ramadan, outside of Ramadan. You can make your dinner meal, like half of your plate be fruits and vegetables. And especially I say do vegetables during dinner and then have your fruit later as a snack. A fourth of it should be your grain, carbohydrates, and another fourth should be your protein. So, and it's, I think if you have a client or a patient where weight loss is an issue, and there are it happens. I usually lose weight during this month because I just cannot eat as much in one setting. Then I would recommend, okay, once you've had your dinner meal, a few hours later, even though you will sleep on that, have a filling snack. So add some protein there, so that it's not just like, oh, I just had a piece of fruit. Add some either nut butter or just nuts there. So you can really, it's going to be individualized in terms of like, oh, are you gaining weight during Ramadan, or are you losing weight, or are you just maintaining? And the goal should not be any of that. If you've changed your habits during Ramadan and you're eating healthier, and at the same time you lost some weight and you want to continue these habits outside of Ramadan, that's perfect. But going in, it shouldn't be, well, oh my gosh, this is the time I'm going to lose weight. And because it's just 1 month and you can't maintain eating one meal a day. It's just not going to happen. If you're going to skip breakfast and only eat dinner, you're more likely to overeat. Not in one setting maybe, but later when you've like had your dinner and then you're ready for another dinner.
Great. Well, thank you so much for sharing all that great information about Ramadan. And for people that are interested, you can go on Instagram and then at Nutrition by Noor, and then that's Noor, to find some great Ramadan, I guess, content, recipes, stuff like that. So I guess transitioning a little bit from someone who's from another country, because you said you moved here when you were around 10 years old, how can you compare and contrast diet culture in America and then Iraq, or just, eating, I guess, nutritional culture in both areas?
Yeah. Yeah, like you mentioned, I moved here when I was 10, so I don't have experience being around people, even though I've visited. But when you visit, it's different than living in a country and you're seeing their habits. But because Iraq has been through so many wars, there were sanctions on the country that were lifted like maybe 13, 15 years ago. And when this happened, slowly foods from outside were imported in. So more processed food where people would have like a farm or just eat more foods cooked more, I guess, less processed and more from fresh. So now it's almost like a popular thing to eat processed food. And it's like almost like, oh, I can afford this and I can do this way. So it's unfortunate because I feel like that's happening now, but maybe the next generation is going to come back and say, no, we don't want to eat this way. We want to eat in a healthier way. So I even have like family members who have messaged me and said, oh, because they do have access, of course, to social media, to internet, and they see like ads for diet pills and stuff. And they've said, hey, I saw this ad and I need to lose this much weight. My doctor recommended because I need to get pregnant. And can you send these pills? And when I've talked to them about actual eating, how they should eat and physical activity, they don't want that. They want the easy fix. And I think that's the culture here now in ways, because we have that immediate gratification. It has to happen right now. And I'm not willing to put in the hard work. It should happen right away. And that's kind of what I'm seeing there too. For some, and for something that's fine, but I think in terms of diet and nutrition, there's not a lot of knowledge behind that. Or they will say, I'm gonna do keto, and they don't really understand what all that's involved. So that really kind of irks me. I'm like, well, how about like eating just a healthy meal? How about your vegetables? How about like taking away all those processed foods? How about because let me tell you, one thing I love about back home is the fruits and vegetables taste so much different than here. So much different, unless you are growing your own in the backyard and you've noticed a taste between those and what you buy at the grocery store. So, but I'm betting, and I haven't been in a long time now. I'm betting that that's changed as well, because again, they're probably using GMOs and other things that are not really, I'm not going to go into that, but it's not the same diet culture here, but it's getting there.
So let me know if I'm reiterating this correctly, but you said that over in Iraq, the processed food is more expensive?
At the beginning, because it was, remember, like there were sanctions and then they started to bring it in. At the beginning, it was very expensive because there was not enough of it. All right. It was almost like a specialty food, all right, to have like packaged foods. But now that there's more, especially coming in from surrounding countries, like for example, Turkey being one of the big ones, they're being imported into the country, and the country doesn't have a lot of, I wouldn't say, because of all the wars and everything, there's a lot of destruction and constructing the country again, and a lot of corruption too. So they don't have a lot of factories to make a lot of this stuff. So it's mostly imported. And so there's a price to get that into the country. And usually I would say, whereas here, sometimes we look at like maybe those below the poverty line, maybe eat more processed foods for different reasons. It's different back home. Those below the poverty line are eating more fresh foods and what they have access to in their backyards.
That's kind of where I was getting at, because like the way you made it sound like.
For sure. I mean, it's crazy when I think about it, because I'm like, if you only knew what people do here because, it's for me to be eating fresh fruits and vegetables. And if I decide to do organic, I have to go out of my way to do that. And back home to do processed food, lately there's more options, but before they had to go out of their way to get access to that.
Yeah, that's super interesting to hear, like the different shifts. So
Yeah.
so I guess in dietetics as a whole, I feel like, at least in my experience, there isn't too much diversity. So how do you feel like, as like new dietitians, RD2Bs, how do you think they should go about like cultural competency to make sure that we're all being, respectful of other people's, ideals, whether it's religious or if it's just a preference or an allergy? How would you advise us?
Yeah, I think dietetics as a whole has to do a better job with this. I feel like even in the internship, not just like in terms of like Muslims or people from Middle East, I didn't really get anything in terms of cultural. It just was like what's offered is like, like the standard American diet, or maybe a small handout on this and that, but it was nothing, like not a deep dive. And I don't think it has to be a deep dive for everything, but depending on the community, like right now, there is a large Kurdish community in Nashville. Well, as dietitians here, are we aware of their nutrition needs and their eating habits? If you have a patient that's in the hospital and you're going in to do a heart healthy diet, and you name off all of these foods that they can have that they will not have because they, first of all, might not even know what they are. Second of all, they already have to follow a diet, and now you're changing everything up. They're not going to do that. So I don't know. I think it's going to be kind of a shift for us to almost like be willing to go out in the community, because I had one whole semester of community work in my internship. Not one of that was to even international food stores. After that, after the internship, I'm very comfortable with my internship, with the internship director now. Then she asked me for a list of all like the international food stores that I go to and what I usually buy. So she has a list now, and the interns actually go to them. They try the fresh bread, they try the different products. And I'm proud of that they're doing that, not just because I feel like, it's nice when others are understanding your culture, because America is just not just Americans, it's just like it's so many different cultural backgrounds. But also as a dietitian, it's more tools in your toolbox. If I say, you know what, oh yeah, I remember, I have, how about this international food stores, I saw these products when I went there, how about these products? It really just is knowledge for you that you can use when you see these patients. So I think it's kind of a shift for us that has to happen. Another thing is, if you do have in your practice or in your hospital, if you have dietitians from other countries, ask them if they will be willing to provide a presentation on their culture, their religion, whatever it might be. So at Vanderbilt, I did one where we did nutrition focused physical exam for Muslims, and what's appropriate, what's not, because a lot of times they will be covered like I am. And so, what's appropriate, which, all of that. So I feel like that was something that, that needed to happen, and I'm glad it happened. So I think just reaching out and not being afraid to ask questions. I'm so happy to answer questions than having someone that's assuming things and not asking me.
Yes, that's one thing that I want to make sure that I incorporate, not only in my internship, but in my undergrad and after, like making sure that you understand that there are different cultures, being culturally competent understanding that certain religions can't have certain foods, or they can't mix foods with each other because of whether it's a religious or a cultural thing they have going on. So yeah, I just wanted to hear your input on what you think.
Yeah, like you mentioned, like about foods, like when I was in the internship, I would see like Muslim patients getting Jello, and I was like, well, this has pork product in it, like gelatin, like you can't have this. And because we can get gelatin from the international store that doesn't have the pork products in it. And I don't know if they just weren't aware that the standard one does. So, but then no one else told them. Like no one, if I wasn't there, no one else would. Or maybe there were dietitians that knew and they could pick up on that. And that has to, and I think the nutrition programs have changed too in terms of like for ordering diets. And now they have like you have to say no pork for that to happen. But if you don't and you're on a regular diet, that's not going to happen. It's going to be sent to you. So there are so many areas that we really need to look into.
Yeah. Well, I appreciate you sharing some info on that. I feel like it's really important for RDs to hear, but especially students that are going to become RDs in the future. So we're, I guess, more prepared to take action as time goes on. So I guess going back to a little bit about education, what do you think how do you think your master's program and your degree sets you apart from other registered dietitians?
Yeah, so like I mentioned in my internship, I did have one semester or half of it was clinical and the other half was community and some food service. So that really kind of helped me pick what I wanted to do. I knew I was just doing community to do it. I was not interested to do that long term. I know I was absolutely not interested in food service. So I wanted to do more clinical. And I was ready to do my master's. That's what I looked for, a good program and a program that was only clinical. I didn't want to have anything else. I only wanted clinical. Of course, if there's like something that's like, in addition to that, that's fine, but the main focus needed to be clinical. So I did my master's in clinical nutrition at Rutgers, and it was really good. I felt like it was like almost like it was a well-rounded clinical program. Even for example, like it was an all online program, but for the nutrition focused physical exam class, we had to actually go on campus for a week and do all the physical examinations and learn to do that. And then once I learned that, I came back and was able to do lunch and learn for my coworkers. So I feel like it really depends on what you're looking for. If you're looking for clinical, then make sure when you're looking at the classes offered that the concentration is clinical. If you're looking more like public health, then look for one that has more classes that are geared towards that. So for me, and just wanting to stay as a clinical person, it really helped me because it just added extra knowledge that I have used throughout the years.
So for the students that are debating, I guess, that graduate in 2021, 22, and 23, whether they should get a master's or not, what advice do you have for them?
Yeah, I mean, it really depends. So I have coworkers that have been dietitians for years. They don't have masters, but they have like, they're certified in nutrition support. They're certified in cardiology, dietitians for cardiology and different things. So if, like, at least for where I work, our manager recommends getting a master's in addition to a license. She just says, it sets you apart from everyone else. So if you know what, I don't have the time to do a master's, I have time right now to study for a certificate, then go ahead and do that, because, at least again, like where I work, that is in terms of moving up the career ladder. So if you're a dietitian 1, to get to a dietitian 2, you have to either have a master's or a certification. So it's almost like they're both weighed the same way in terms of like a raise and all of that. So if, it depends if you have kids and if you can't, don't have time to do the master's, and at least do a certificate.
Great. And then we texted out on our platform this morning to see if there were any questions for you. So we do have 2. I guess the first question is, what is your favorite recipe?
Yeah, so okay, I'll give like a cultural one and then like more like a Western one.
Great.
So in terms of like a cultural one, I don't know if you've ever had like the rolled grape leaves with the rice in it and the veggies. No. Okay, so it's so good. It's called dolma, and some places like Kurdish call it iprach, Iprax, and the X is pronounced like ch, like iprach, and it's so basically some cultures will only have the grape leaves that's stuffed and rolled, but the Kurdish culture we have other vegetables. So we have like peppers, tomatoes, eggplants, zucchini, and you take the inside out, the stuffing, and then the actual stuffing that goes inside is a mixture of rice and then whatever protein you want, whether it's like beef or chicken. Usually it's beef, and then that stuffing that you take outside, like let's say you have an eggplant, that stuffing that you take out, you dice all of that and you add that to the rice mixture, and then there's so many different spices you add, and then you add tomato paste, and then you stuff the vegetables, and then the grape leaf, like it's flat, and you put some of that stuffing on it, and then you roll it, and you just like layer all of that in your pan, and you add water and some just different spices to that too, and it's so good. I wish we lived close to each other. I would send you some. So that
I'm definitely gonna get the recipe from you later on that.
Yeah, look for even like if you have any Middle Eastern restaurants, sometimes I've seen like canned dolma. I've never tried it because I'm like, it's never gonna get close to what you do. Have you tried it? It's never yeah. It's just not gonna get close to making it at home and fresh. So you can get canned and just to try it. But if you have any Middle Eastern restaurants, look on their menu and look for dolma and see if they have that. Okay, that's gonna be like more like Iraqi Kurdish. The other thing I love is pizza. And for me, I will not eat plain pizza. I don't like dairy as much, so I cannot see any cheese. It needs to be like almost like I call it like salad on pizza. The whole thing has to be covered. And I try to fit in as much as I can and that the dough will like handle, and to the point where I cannot taste any cheese, which is funny to like pizza and not like cheese, but that's the only way I like pizza, and I really love it. So
that's awesome.
Yeah.
Have you ever tried pizza without cheese? Just like red pizza?
So we do something like that in like a Kurdish, and it's basically like that. It's like a pizza where you put tomato sauce on it, and you can put some ground coriander, or you can put some ground beef on it as well, and it's really good. But I think when I think of like pizza, I think of something that has cheese on it. So I've never tried it without cheese, and I don't know how the vegetables would stick on there. Yeah, like the only reason I use the cheese is kind of like I say it's the glue to make sure everything sticks on there. Like whatever I can put, it's as much as I need to make sure they stick on there. Other than that, I'm not a fan of cheese.
And then I guess the next big question, which I mean, it means a lot to me, not many people. When you have pizza, right, there are three options. 1, you cut it. 2, you fold it in half and eat it. Or 3, you just pick it up and eat it. How do you eat your pizza?
I pick it up and eat it.
Pick it up and eat it. Awesome.
I think if I'm trying to be fancy and I'm somewhere and I'm like, I need to like be on my best behavior, then I'll cut it. But if I'm at home, I'm gonna just pick it up and eat it.
Yep, like a first date, you have to cut it, you have to be nice. Date number 3, you're just throwing it in your mouth. And then I guess the next question that we got texted in is, where do you see yourself in 5 years?
Yeah, so it's for me, so I have a daughter. My daughter is 8.5 and my son is 4.5. So I would say over the past 8 years, my focus has been more family, and I've worked part-time to be able to take care of them and be home for them. So after I started this functional medicine training, which is going to take maybe 2 to 2.5 years, depending. I think hopefully in the next 5 years, maybe having my own practice, doing more like, nutrition across the ages and not just pediatrics, because I have done adults, inpatient, outpatient, and I've done pediatrics. So I think focus more on adding functional nutrition to that.
Great. Well, thank you so much for taking time out of your day to talk to us. And yeah, we got so much great content, some great, recipes to try, some resources that we can check out, like Ramadan nutrition, stuff like that. So I greatly appreciate it. Thank you so much.
Thank you so much for having me. If anyone has any questions, I had someone that messaged me that's doing a project and had questions on Ramadan. Please reach out. I'm more than happy to answer them. Again, the guides are there too if you need to refer to them. And thank you again for having me.
Thank you.
Yeah, thanks so much, Noor. And you got me hungry talking about dolma.
Me too, and I'm fasting.
I'm gonna go grab a snack here after this, but I'm glad you're willing to share your info and any students who have any questions. It's always great. This is why we're doing this, because I think a lot of students don't realize just how giving dietitians are, and you kind of put dietitians up on this pedestal of already practicing, but so much of us have this information, you just got to ask for it. So really
Right. And this was not the case. Like, I graduated from my internship in 2008. And honestly, going in, I was almost like not sure what the internship was all about, what exactly I was going to get out of it. There weren't any, like, social media was not as popular. So you kind of were on your own and what your advisor and others told you about the internship. So I'm so glad these podcasts and educational sessions are being done, because not only do we all need to be more aware of what's out there, but also I feel like dietitians are practicing in so many different areas. I'm like, oh my gosh, you do that? Oh my gosh. So I feel like for interns, they need to like know that when you graduate, maybe your first job might not be like your dream job, or you're just taking a job just to kind of, pay bills and stuff for the time being. But just knowing that down the road there are so many different areas you can explore is just amazing.
that hits home so on point. Absolutely. So thanks again, and everyone tune in. We'll have another fantastic interview next week.
All right, thank you so much for having me.